It is 8:14 at KIOW, sunny and 28 degrees. Many people probably don't realize it's National Public Health Week this week. A great time to have a morning conversation with Betty Mallen. Betty, of course, has worked at Hancock County Public Health for many years and is now Hancock County Health System's health coach. Good morning, Betty. Let's talk about the recent changes at Hancock County Public Health.
Good morning, Mark. Yeah, there have been some changes that have happened with Hancock County Public Health and Hancock County Health Systems. A few months ago, actually the Board of Health has always had on their strategic planning that they wanted a county health system, and a few months ago saw the opportunity to begin to integrate those services. So the Board of Supervisors, the Hancock County Board of Health, and the Hancock County Board of Trustees here at the hospital decided that this was a great opportunity to explore that.
What changes will we see because of the integration, Betty?
Really, the integration should be transparent to our residents. Other than the obvious name change from public health to community health, otherwise the services really are going to stay the same and are just integrated into the hospital services. And we also offer the home care service, which allows the residents, to stay in their home. And then my position is a new position here at Hancock County Health Systems, and this gives me an opportunity to meet directly with patients to help them identify ways to be successful in improving their health, and also to help them set some realistic health goals.
We're talking with Betty Mallen. And Betty, what about the changes to the county tax support due to the integration?
Well, the whole goal of the integration was to reduce the health care costs by actually reducing the duplication of services and trying to be more efficient with the care that we provide. So if you look at what historically the tax levy support for Hancock County Health Systems covers the tax expenses for the employees. And so 12 employees transitioned from public health into Hancock County Health Systems. So really the increase will go from $1.32 per 1,000 to $1.40 per 1,000 to cover these additional employees. Also, though, just to note that the last tax levy increase was in 2008. That went from $1.30 to $1.32, and the highest tax support ever was in 2005, and that was at $1.49. So all 12 of the public health employees have integrated into Hancock County Health Systems, and that's why will be a bit of a change in the tax levy.
Anything that doesn't change due to the integration?
Hancock County Board of Health will still continue to meet and review and implement state health policies and regulations for the county, so that's not going to change. The Board of Health isn't going to go away. The Hancock County Board of Supervisors will continue to directly employ and support the environmental health position that before was under public health will now go back with the Board of Supervisors. So really, not any big major changes because of the integration.
What are some of the programs community health has to offer residents, Betty?
Well, the same things that they've seen before, but just to kind of review those, we do communicable disease surveillance, which is like when we had the whooping cough outbreaks. Public health does that investigation, tries to find the contacts of those people to try to stop the spread of disease. That will continue. Immunization clinics will continue with those just as they were. The one big difference will be that those immunizations probably will not be at the public health office. They'll be at the clinics now where people will be able to access those services. Still do the screening services of blood pressures and blood sugars for the community, health education to community groups, and then some of the prevention programs, fall prevention, bike safety, home safety, those types of things. So really the programs haven't gone away. We've just tried to look at where are we duplicating and how could we integrate them together so people get more of a seamless health system.
Betty, one thing we do want to tell our listeners about is the fact that the Britt Community Garden has a planning meeting scheduled this weekend.
Yeah, that's right. On Saturday, April 6th at the Britt Municipal Building, 9 o'clock, there's a planning meeting for that community garden. Anyone is welcome. You don't have to be a gardener to participate. If you just would like to see what it's like to maybe plant a garden, be able to get some of the produce, that's really what it's about. It's about bringing the community together around something which really can be very, very pretty in the community, but also can provide people with an opportunity to try maybe some vegetables or things they've never tried. Also, the Garner Community Garden has a meeting on April 13th. And that one's at the library in Garner, and I believe it's at 9:30 that one starts. So here's opportunities for our county residents to get involved in a preventative health program.
Betty, I guess we just want to let people know, too, that the community health will operate in the public health building on State Street in Garner, right?
Yeah, they will continue to have an office there. The phone number stays the same. The hours of operation are the same, 8 to 4, Monday through Friday. One of the differences that you'll see is that no longer does public health have a separate website. That's been kind of integrated into the Hancock County Health System website, and that is www.trusthchs.com. So if they were used to looking for information on the public health website, that's the website they need to use now to find that same information.
Betty, thank you for all the updated information. We appreciate it.
Thank you. You have a great day.
You too, Betty. Betty Mallen with Hancock County Health System. She's the health coach. She's our guest on Morning Conversation Part 2 on KW. It is 8:20.